Welcome to Shape Healthcare and Happy New Year to you. Welcome to our Health and Wellness series. My name is Edwina Paxson and I'm your host for today. We're in the month of January, and globally, January is recognized as the Cervical Cancer Awareness Month. We are here today to educate you, give you more information, and throw some light on what cervical cancer is all about. Today, we are going to have a conversation and an engagement with the renowned consultant, obstetrician gynecologist, Dr. Promise Sefoga. Dr. Sefoga is a senior lecturer at the University of Ghana Medical School. He also coupled as the CEO and medical director of Shape Healthcare. Doc is going to take you and I through everything we need to know about cervical cancer, its preventive measures, risk factors, and the good news, vaccination. Join me in the consulting room. Let's ask all the questions and find answers to everything you need to know about cervical cancer. We are here with the renowned consultant, obstetrician, gynecologist, Dr. Promise Sefoga. As I promised you, it's going to be an informative engagement with Dr. Sefoga. Hi, Doc.
Hello.
Hi, it's nice to meet you once again.
Great pleasure to be with you too.
Thank you so much for having us. So we are here today on conversation on cervical cancer. Since January is already recognized as the Cervical Cancer Awareness Month globally, would like to have some engagements with you to educate and inform the general public on cervical cancer. Why the need for the screening? Because we've been hearing screening in the last week on cervical cancer. My first question to you would be, what exactly is cervical cancer and how does it develop?
Good. So thank you. Cervical cancer basically refers to cancer of the cervix.
Okay.
And the cervix refers to this little part of the woman's reproductive tract, which we call the cervix. Okay. So this is the uterus or the womb. These are the tubes, and this is the ovary. So a woman releases her eggs from here. The eggs travel down the tube. It gets fertilized in the tube. It develops here into a baby. After 9 months, baby comes out. So this lower part of the womb, which is like the mouth of the womb, that is the cervix. It's a small organ which pretty much feels like the tip of your nose. Sometimes when the woman is washing and they insert their finger, they feel something that feels like the tip of the nose. That is the cervix. A small organ hiding there. Then it develops cancer. And so you can see that it is hiding. And so the reason why it's important is the cancers there do not show symptoms early until things get too late. Now, cancer just refers to abnormal development and multiplication of cells.
Okay.
So cell division is a normal thing, which is why when you cut your hair, it grows back. When you cut your nails, it grows back. The whole human body came from 2 cells, one from the woman, one from the man, became 2, became 4, became 8, became 16, 32, and then a whole human being. So the cells in the body are programmed to be dividing, to be replacing the dying ones. But at a point, the cells can multiply out of control. Then that becomes cancer. Right. So cancer of the cervix is the abnormal division of the cells in the cervix to the extent that it becomes out of control of the body and then spreads to other parts of the body. And it's a leading cause of cancer in women in Ghana.
Wow. So, Doc, we've been hearing that cervical cancer is highly sexually transmitted.
Correct.
I mean, during our basic science days, we've known of the sexually transmitted diseases, and cervical cancer has never been a part of it. But per your explanation, cancer is developed from the multiplication of cells in excesses.
Yeah.
So how is that sexually transmitted then?
Good question. So what happens is, in the case of cervical cancer, a viral component triggers that abnormal cell division. And that virus is what we call the HPV, the human papillomavirus.
Okay.
And so somebody has unprotected sexual intercourse with a man who is carrying the HPV. And so the man passes that on to the woman. The virus goes to hide in the cervix without causing any obvious symptoms for between 10 to 15 years.
Wow.
causing damage underground.
Wow.
And so, if you don't do screening over that 10 to 15 years, you wouldn't be able to detect that, there is some viral activity, let's deal with it. And so, by the time it's finished causing the damage, symptoms begin to show when it is really too late.
Wow.
Okay, and so we are told that up to 70% of sexually active persons carry the HPV, and this HPV is by far the commonest sexually transmitted virus.
Oh, really?
HIV, hepatitis, they don't come close.
Really?
Yes.
That's makes cervical cancer more deadly than
More deadly,
we would
yes.
associate to the HIVs and the
Exactly.
wow. But okay, I think my challenge with the whole cervical cancer awareness, like you are doing and educating it, we've not had much information, unlike we know of the HIVs, the hepatitis, the regular, we encourage people to do regular screening. What would you advise we do? Because this information is actually quite sensitive.
Yeah, so cervical cancer is the leading cause of cancer-related death in Ghana among women.
Wow.
Now, we are told that in Ghana, every year, nearly 3,000 new cases are diagnosed.
On a yearly
In
basis.
a year, 3,000. And unfortunately, we tend to diagnose them in the later stages. Cancer is divided into 4 stages. Stage 1 is early. Stage 2, stage 3 is advanced. Stage 4 is terminal. Okay, and majority of these cases we detect are in the advanced stages where it's literally too late. Okay, and of these 3,000 we diagnose every year, half of them usually die because we detect them rather too late. Which is why everybody needs to be aware. The women primarily, their partners, their brothers, their boyfriends, their uncles, everybody needs to be involved in driving the awareness on cervical cancer and its prevention.
Yeah, because the cervix seem important to everybody.
To everybody,
Everybody, even
yes.
to the babies that are yet to be born.
Absolutely.
Wow. So, Doc, you've mentioned the HPV virus. What are other causes of cervical cancer?
So, the main cause in more than 99% of cases of the type of cervical cancer, which is common in our part of the world, is HPV infection. Like I said, it is sexually transmitted. So then, a woman who has not had sexual intercourse does not stand a risk of cervical cancer
Oh,
in
okay.
majority of cases.
Okay.
Right. Now, some women may have other conditions which are also caused by other types of the HPV that do not cause the cancer. Something like what we call genital warts, where the woman has some type of rashes on the external genitals, on the vagina, on the vulva. Initially may look like sand, then it gets bigger, very itchy. We call it genital wart. It's caused by other types of the HPV.
Okay.
So if a woman has that type of HPV, it's more important to even look further to see if she may have been exposed to the type which also causes cervical cancer. That said, certain conditions would increase somebody's risk. We call them risk factors. Somebody who started having sex at a very early age compared to somebody who started having sex later on. Somebody who has plenty more children compared to somebody who has few.
Yeah.
Somebody who uses other medications that suppress the body's immunity. Sometimes when we do organ transplant, we put somebody on medication that is supposed to ensure they don't reject the thing. Those can lead to increasing the risk of cancer.
Oh, okay.
Somebody who has HIV, somebody who has any other sexually transmitted infection may have also come into
Exposed to
contact
the
with
risk.
HPV.
Okay.
Somebody who has diabetes which is not controlled. And then people also use steroids for various reasons. The women these days are using a lot of steroids for bleaching, and a lot of steroids would also suppress your immunity and increase the risk of getting cervical cancer. Because if your immunity is working well and the body gets exposed to HPV, the body is able to clear the virus. But in a large number of cases, it persists if these other conditions prevail.
Oh, wow, that's such an informative session we are having right here. So, now, like as a woman or a young woman, I mean, having infections or sometimes you get discharges here and there. Is there any cause for alarm? Is there a need for worry if a woman should see any form of discharge? And what are some of the early symptoms of cervical cancer? Is discharge part of?
Yeah. Cervical cancer in the early stages does not give any symptoms, and that is the danger of it. Like I said, for the 10 to 15 years that the HPV is there, the woman does not
Doesn't
know
cause
she's carrying
any.
anything. Okay. By the time the symptoms begin to show, it's probably already late. And these symptoms include abnormal vaginal bleeding.
Okay.
The woman could be having heavier than normal menses, or she could be bleeding in between her menses, or something we call contact bleeding, where anything goes to touch the cervix, it provokes bleeding. So commonly during sex, the penis goes to touch the cervix, it provokes bleeding. Or the woman goes to hospital, they do some form of vaginal examination, then she starts bleeding. We call it contact bleeding. Okay. Another symptom is abnormal vaginal discharge. Now, every woman gets some discharge. Around the time of the woman's ovulation, the discharge gets a bit more, but it's supposed to be clear and very stretched. A normal vaginal discharge is usually clear
Okay.
or at worst cloudy.
Okay.
It does not itch. It does
No
not cause any
smell.
irritation. Does not have any smell. Anything outside these will make the discharge abnormal. Cervical cancer typically has a discharge which is extremely offensive. Okay, you can detect the smell from
A distance.
a long distance.
Wow.
That is typical.
Wow.
Okay, and that tells you that things are already too bad.
Hmm.
And then, as the cancer advances, the woman is not able to eat. She gets weak. She loses blood. She becomes anemic, easily tired. And then the cancer begins to spread. It spreads to the uterus, can spread to the liver, spreads to the lungs. Then we are getting issues, and then ultimately, if nothing gets done, we lose them.
Wow. So, from what you have just told us, when the woman sees these signs, that means that
If you wait for these signs, granted, other conditions may present with similar. So, the question you asked about vaginal discharge, when you have a discharge which is abnormal,
you
you have a
visit
discharge you are not sure about, it's not in your place to decide, oh, this
to
is
get over the counter medications. Yeah.
maybe
Yeah. You
sitting on
need to
something,
visit a specialist.
yeah, maybe sitting on something a lot more severe.
You know, it's very normal when we see anything abnormal, from our system. We are just, easy to go pass through the pharmacy and just get something to treat ourselves. So this is more of you need to visit a specialist for
And get
a
checked.
thorough.
And then because during that interaction, the caregiver would ask you a question, have you had your pap smear? Then we can even begin the discussion of getting screened for cervical cancer.
Wow, interesting. You've heard it all, guys. You've heard it all. I'm actually very worried after this session with Doc. I've been very worried and concerned because most of the things Doc is mentioning here are things that are particularly common amongst we women. So now that I'm having the information that it's actually quite disturbing, I'm worried for every woman out there.